Dr. Gutman, I saw a great question in the chat there about diabetes. So I was wondering if you could, help. What's the relationship between glutathione and diabetes?
This is a really, really important question. People with diabetes or someone who's taking care of somebody with diabetes always ask the question, what is glutathione going to do to my sugar levels? And the answer is not a lot. It's not going to do a lot for your sugar levels. And some people find that there is an improvement, but that's not why I recommend it to every diabetic. So you need to ask yourself the question, what is it that gets a diabetic sick? What sends a diabetic to the doctor, to the hospital, or to the grave, God forbid? Well, there are two major reasons that cause morbidity and mortality in diabetes. Number one is diabetics need to be considered as immunocompromised. Diabetics get much more infections than a non-diabetic will, and anything from infection in the toe to pneumonia, to skin infections, to fungal infections. So if you can raise the immune response in a diabetic, you can give that person an additional benefit of being more resistant to these infectious circumstances. But the major reason that diabetics get into trouble is because of their vascular system, their circulation. If the circulation in a diabetic is affected to their eyes, they get diabetic blindness. The circulation is affected to their kidneys, they get kidney failure. The circulation is affected to their peripheral nerves, they end up with a neuropathy. And diabetics have a much, much higher rate of heart attacks and stroke. So what's going on here? Well, in a diabetic, because of the environment that their cells live in, there's a much higher degree of oxidative stress. Okay, so diabetics have higher oxidative stress. Now, in our blood, we have circulating fat. The most common, which you've all have heard of, is cholesterol. Now, when these fats become oxidized, something we call lipid peroxidation, they turn stickier, so to speak, and they end up gumming up your arteries, and you develop plaques, and you develop poor circulation, and you have heart attacks and strokes and blindness and kidney failure and all of those terrible manifestations of long-term diabetes. So these fats are being oxidized. What is the substance circulating in our body that prevents these fats from being oxidized? It's a biomolecule called glutathione peroxidase. If you raise glutathione levels, you raise your glutathione peroxidase, and you're able to keep these fats, like cholesterol, in a safer state. So this is true preventive medicine. No, by raising glutathione, you're not lowering your sugar levels, but you're preventing the long-term sequela, the long-term consequences of having the diabetes. This is truly preventive medicine at its best. So whoever asked that question, thank you.
Yeah, that's a great answer too. This one is a little bit related to business a little bit, but it is product. And that is, we have so many competitors out there, and I know we're not here to slam anybody, but maybe just a couple of quick words that comparing, our product Immunocal to the many pretenders out there that also say they raise glutathione.
Well, imitation is the best form of flattery. And Doug, you and I have been around for 25 years now. And in the first few years, we started seeing knockoffs of Immunocal that were just shameful. But as the science of glutathione has evolved, people are understanding the importance of this biomolecule and the tremendous potential of raising glutathione and addressing the clinical issues. And so there have been others. There's an excellent drug called N-acetylcysteine. This is a drug that's used in the hospital quite commonly, in the emergency room, in the radiology suite, and it's very effective, except NAC, or N-acetylcysteine, does carry a lot of side effects. And the doses, you can find NAC actually in some health food stores, but the dosages that you find available to the public without a prescription are much lower than what we give in the hospital. Now there are other products that are oral glutathione, and people are still pitching and selling oral glutathione, and it just doesn't work. There is 175,000 articles on glutathione. There's one or two that have shown that oral glutathione works, and there are dozens or hundreds that have shown that it doesn't work. So, it's 200 articles to one article that says that it works. I mean, you've got to pick and choose. And the two articles that have shown that oral glutathione works happen to be written by the same author, who was paid by the makers of glutathione to have a positive article. There are other forms of raising glutathione, or glutathione patches, which are nonsense. Glutathione suppositories. I don't even think we should go there, Doug.
Liposomal, we get a couple of questions
Yeah.
in the queue about liposomal. Maybe you can address that.
Yes, liposomal glutathione is just taking oral glutathione and putting a lipid sheath around it, supposedly for it to absorb better. But I want anybody to show me some articles where this works in humans. Besides the one or two, you won't find any articles well done. Human trials, remember, they have to be human trials. Oral glutathione works in animals, but not in humans. Show me a double-blind, placebo-controlled, statistically significant study in humans where this works, and I'll be glad to talk about it. But I'm on top of the research every day, and it's just not out there.
Right. Beautiful. I have three separate questions, all relating to kidney function, kidney dialysis, things like that. So perhaps you could hit on that for us.
Yes. In kidney failure, in renal failure, many patients are told by their physician to limit the amount of protein that they're eating, because the protein is a challenge for kidneys that are failing. And if you eat too much protein, the kidney failure gets worse and you get into trouble. So Immunocal is a protein. And so why am I recommending Immunocal to someone with kidney failure or someone on dialysis? Well, you're not told to eliminate protein. You're told to limit protein. So if somebody is limited to 40 grams a day of protein, then if they're taking a 10-gram pouch of Immunocal, you're far better off 10 grams of Immunocal than a Wendy's hamburger. Because if you're limited to the amount of protein that you can take the best damn protein that you could find. And when we look at oral proteins, we assign a value. We can assign measurements to oral proteins as to how important they are to you, how well they're absorbed, how much of the protein is made up of essential amino acids versus non-essential. There's one measurement called a BV, or biological value. You will not find another edible protein in the world with a higher biological value than Immunocal. So this really is the best protein you can eat. And in my book, there's a whole chapter on kidney disease and dialysis. Um, Raising glutathione in kidney disease is extremely important, and it's extremely important in dialysis too, to conserve hemoglobin and other parameters that we follow.
Beautiful. One of the questions that we got is, I know this will be an easy one for you. It's almost like taking a break. Is there some way to measure the amount of glutathione that we have in our bodies? How does that actually get done in the studies and things like that? And then dosage wise, like some people have commented when they get feeling down, they want to take 2 or 3 packs a day. Is there anything such thing as too much Immunocal?
Well, let me do the dosage one first. The maintenance dose for a young, healthy person, and young, there's actually a medical definition, is under age 45. If you're under 45 and you're in good health, the maintenance dose is 1 pack a day. For someone who's my age, haven't seen 45 in a long time, I will take 2 packages. And if I'm under the weather, depending on what's going on, for example, if I'm going to go out and do a big conference with 300 people and shaking hands and kissing people, and I'll take 4 packs a day just for its protective effect. Or if I feel like I'm going to wake up the next morning with a cold, I'll double up my Immunocal. So people who are either currently have a challenge or they're on in their age should be taking 2 packages. People who have a major health challenge, like in our studies, we were using 3 packages or even 4 packages a day for these very compromised patients. There are people that take even more. I think that it's diminishing returns. There are some people who require more. For example, some people with chronic fatigue syndrome require a lot more. So this being a natural product, it's not like there's a specific dose like with a pharmaceutical. We all have different genetics. We all have different challenges. But those are rough guidelines. What was the first part of the question, Doug?
How do we actually determine glutathione levels in people's blood?
Right. Measuring glutathione levels accurately and correctly is a painstaking procedure. It takes a laboratory that really knows what they're doing. And to date, it's still rather expensive. It'll probably cost you between $200 and $300 to do properly. You will find a lot of people online that they say they're going to measure your glutathione for $20 or $30. But it's a waste of time. It's a waste of time. These are not accurate tests, and sometimes they're not really measuring glutathione at all. So yes, you can get a glutathione test. You'll have to pay a lot of money for it. There are more and more people that are fine-tuning and getting on with better testing. It's still, I can't see a test for less than $70 or $80. But this is coming. Given the enterprise of Americans to take advantage of new opportunities, this will come, and there will come a day where your general doctor will measure your glutathione on a yearly basis, the same way as he or she measures your sugar or your cholesterol or anything else. If you speak to cardiologists, they will tell you that glutathione measurement is a great indicator being risk at having a heart attack. You speak to kidney doctors, they'll tell you the glutathione measurement is sometimes even better than a BUN or creatinine. So this is coming, but not yet.
All right. Just had a couple little hiccups in there, Doc, but I think everybody basically got the message. You were glitching a bit. So another question we had, that's okay. A couple of questions regarding autoimmune disease like lupus and different ones like that. So maybe if you have just kind of an all-encompassing answer for autoimmune in general.
This is a thinking man's a question, or a thinking woman's question. If we're saying that glutathione is food or fuel for the immune system, then if someone has an autoimmune disease, is it not possible to make them worse? It's a great question. You really got to wrap your head around that. And the answer is no. Autoimmune disease is highly complicated. The immune system is still, we're only in our infancy in its understanding. But generally what we find is that something in the immune system is imbalanced. For example, if we look at lupus or rheumatoid arthritis, these are two classic autoimmune diseases. There's an imbalance in the white blood cells. There's a overexpression of T cells and an underexpression of B cells. And so if you put glutathione into the system, you rebalance these two cell groups, and you end up with less inflammation, less pain, and an overall better outcome. I've been looking at this for over 25 years, and I've yet to see a single case of an autoimmune disease get worse on Immunocal. In fact, the majority of them end up benefiting. So great question.
That is a great question. There's a couple there that you may want to read. They're in French, Dr. Gutman. I know one of them is regarding arthritis and rheumatoid arthritis, the different forms of arthritis. So perhaps you can address those. They're in the, you'll see the Q&A section there.
Yeah, just go and look at it now. Wow, a lot of questions on different ways of raising glutathione. Isn't that interesting?
Yes, I noticed that myself.
Yes, so the question in French is about rheumatoid arthritis, which we talked about, and the answer is yes, there is benefit, but then they're talking about good old osteoarthritis. Now, osteoarthritis is a different type of arthritis. It's a more common arthritis, and we do find benefit raising glutathione, but it takes time with osteoarthritis. This is a condition that takes years to develop, and will take at least 2 to 3 months before you feel any major change. Unlike an infection where these cells turn over in 24 hours, you could see a very fast response to Immunocal. For something like osteoarthritis, it will be slower, and you will have to have some patience.
Right. There's a question. There are questions all over the place here. LDL and HDL levels. Is there any, how's glutathione impact those?
This goes back to our cholesterol issue. There's low density cholesterol, LDL, and high density cholesterol. Think of H as happy and L as lousy. Okay, so we like the happy one, but we don't like the LDL. And the LDL cholesterol is the cholesterol that's involved in plaque formation. And just like in the diabetic, where this plaque becomes oxidized, Well, you don't need to be a diabetic to have oxidation take place in your bloodstream. It's curious because diabetics have a higher degree of oxidative stress. And it's one of the reasons why doctors put diabetics on cholesterol lowering drugs earlier than they would a non-diabetic. But regardless, the key is to stop the LDL from oxidizing, because the oxidation will make it gummy. It will start to develop sludge inside of your arteries, which will narrow your arteries, narrowing of the arteries, which will harden your arteries, hardening of the arteries, and which will cause the organs that are supposed to be receiving a certain amount of blood to receive less blood. And this is why we have angina and strokes and all the other things that come along with cardiovascular disease, which is for the most part a consequence of plaque formation, which is a result of this cholesterol. Of course, it's much more complicated than that, but this cholesterol gumming up your arteries. So this is a major reason for anybody over 45 for sure to be taking a couple packs of Immunocal to raise their glutathione levels to prevent that.
Excellent. Well, I know there's lots of questions flying around here. I know we don't have a whole lot more time. What about bone fractures, which is actually a kind of a question you don't hear all the time, but just, with the healing process, if someone's, and this is obviously going to encompass any kind of accident, trauma, injury to the body, broken bones, whatever. So.
Yes, the healing process, whether it's a laceration on your skin, a broken bone, a fractured spleen, the healing process has everything to do with the immune response. People with a weak immune response do not heal well. And again, in my book, I have a whole chapter on trauma, where we look at people that have been physically traumatized, and they do heal faster. And there have even been studies in the surgical intensive care units where people with higher glutathione level leave the ICU earlier than those that don't. So that's a big yes, and that's a good way to end off the night.
Well, Jimmy, maybe if you have time for one more, this is
okay.
Everybody, like, this is an important question, I think, for a lot of people. It goes back to the that dirty old C word, and the chemotherapy. And the question is really pressing for a lot of people. Like, is it okay to take Immunocal while you're taking chemotherapy? Should you wait until the chemotherapy is finished? The whole relationship between glutathione and chemotherapy and treating cancer. And then we'll end on that one. I apologize to everybody, if you didn't get your question answered, but hey, there's always our next meeting. Go ahead and answer that one, Dr. Gutman, and then I'll wrap stuff up.
Yeah, I'll answer that. You really got to follow along. Sometimes I lose people, sometimes I lose myself. And Doug, maybe one of these calls, we can have a call just on cancer. But the question is about not just cancer, but cancer and chemotherapy or radiotherapy. Many physicians and many oncologists and many radiologists tell people to stop taking antioxidants before treatment because they're worried that the antioxidants will interfere with the treatment. And this is especially the case with glutathione, because there are a lot of studies that show that glutathione will lead a cell to become more resistant against the glutathione will cause resistance against the chemotherapy. In other words, it will block the chemotherapy. All of these studies have been done in test tubes or in tissue culture. There hasn't been a single study that showed this to be the case in a living human being. And I've been answering this question for 20 years now, and I got tired of having to answer it all the time. So I actually wrote an article on this. It was an article on raising glutathione in face of chemotherapy and radiotherapy. And I have yet to see a single study where it backfired. I haven't seen a single study where it backfired. And in fact, most of the studies that I've looked at, it turned out to be a good thing. But of course, I'm going to tell you all that you do need to listen to your attending physician or your medical team. If they say, don't take Immunocal with your chemotherapy, you say, well, let me just show you this first. I'm going to listen to what you say, but let me show you this first. And we will give you access to a study that we did in this case, it was lung cancer patients who were receiving chemotherapy and radiotherapy and Immunocal to raise their glutathione levels. And you'll see how much better they did. And a copy of my paper where I go through all of the literature where this has been looked at, and if the physician reads that, then he or she will change their mind. But of course, we have to have a legal disclaimer that we are not a product that can cure cancer, and we make no claims about it. But we need to show you the research and let you and your treating health team make the decision themselves. And most of the time, it's very convincing.
Right. Hey, listen. So thank you very, very much, Dr. Gutman, for that. I mean, it's always amazing you feel like you're, really on the cutting edge of what's going on in the back room, scientific rooms with Immunotech and all the research and everything. So it's wonderful for you to take your time and share this great information with us. Everybody, you can get Dr. Gutman's book and on the website he shared with us earlier. And I've had some questions about this video. It is available now, and you can link to it through Dr. Gutman's YouTube page. I'd like to thank everybody for attending tonight. And again, we apologize if you had a specific question that you didn't get answered. We'll try to do it at our next meeting, which is the 13th. It's going to be the Thursday. It's always the second Thursday of the month. So the 13th of April coming up, we'll be having another one of these meetings. And I want to thank Lucien very much for his work translating for us tonight. It's greatly appreciated. Everybody coming together with these calls. We're up to 175 people tonight. Next month, I'm sure we're going to break 200. So again, thank you all so very much for your time tonight, and we'll look forward to speaking to you in a few weeks. All right, thanks everybody.